Good morning. My name is Professor Moody. I'm the director of our Histotechnology program. And with me today is Professor Lester. She's the director of our Medical Laboratory Technician and Phlebotomy Technician program.
Good morning. Glad to have you all with us.
And we're here to talk about the lab sciences programs here that we have at CTC. So our lab sciences program includes 2 associate's degree programs, one in histotechnology and one in medical laboratory technology, and a certificate program in phlebotomy technician. And we're here to share what those are, what we do, how we participate and how we help out, and how we're a key part of the healthcare field. And maybe to put the idea in some people's heads that this might be the field of healthcare that they've been looking for, that they thought, if only there was something like this that existed, I would love to do that. So we can talk about our programs a little bit. So first, we can talk about what our medical science is, what our clinical and anatomic pathology services are. And our main role is to help diagnose a disease. We do all of that lab testing. Every time somebody goes to their doctor and they say, we're going to run some tests, what they really mean is, we're going to run some tests. So we are a behind the scenes sort of part of healthcare. There's a lot of times where the patient doesn't see us or know that we're there, but we're helping to provide answers to questions so that the providers and the nurses can use that information for treatment. So the first program that we'll talk about is our certificate program in phlebotomy. A phlebotomist, go ahead, and Professor Lester will take over on that.
So again, I'm Professor Lester. I'm the program director for phlebotomy, and I wanted to talk to you a little bit about what exactly a phlebotomist does. So the phlebotomist is very important to the hospital, to the laboratory. The phlebotomist is the face of the laboratory. So if you love to interact with patients, if you're a people person, we would love to have you as a phlebotomist. The phlebotomist is responsible for collecting specimens, primarily blood specimens through venipuncture, so through using a needle and inserting that into the vein and collecting blood, and also preparing the specimens for delivery to the laboratory. They also, in some cases, help monitor and collect other specimens. We also have specimens and tests such as a glucose tolerance test, if any of you have had experience with that. The phlebotomists are, again, the face of the laboratory. Whenever the patients complete a survey about their experience in the laboratory, they are not seeing most of the other people that work in the laboratory. They're thinking of the phlebotomist. And so the phlebotomist is really the face of the laboratory. Their role is very, very important. So not only do the phlebotomists collect and prepare specimens, but in our program, which is a 1-semester program, we also focus a little bit on training our phlebotomists also as lab assistants. So they're not fully certified as lab assistants, but we like to give our phlebotomists a little bit of experience in maybe setting up some microbiology cultures or just some basic experience in the laboratory, assisting the other laboratory professionals in preparing some of the specimens for testing. The phlebotomy program is a 1-semester program. So there are 2 actual phlebotomy classes. One of those is phlebotomy. The other one is a clinical portion. So One of the classes, phlebotomy, which is PLAB 1323, is a classroom instructional didactic class where you will have a lecture and a lab. Now, this semester is a little bit different, obviously. We're going to be delivering the lecture portion of the class online. The laboratory portion is going to still be delivered in person because there's really no way to learn phlebotomy unless you're able to actually perform phlebotomy. And so that portion will still be in person. The class is currently scheduled on Tuesdays and Thursdays from 5 to 7:50. So it is almost an evening class, not quite considered an evening class, but a late afternoon class. The clinical portion, however, is during the day, so during the day shift in the hospitals. And our clinical requirement is 15 days, so 15 8-hour shifts of clinical experience in local hospitals. And so our phlebotomy students actually go into the hospitals in the local area and work alongside other phlebotomists and laboratory professionals and practice their newly learned skills on patients. And so whenever our students graduate from our phlebotomy program, they are very experienced. They are required to have a minimum of 100 clinical hours in the laboratory and a minimum of 100 successful sticks. And they usually reach that within the first, I would say the first week at least of their clinical rotations. They also take anatomy and physiology for medical assistants, medical terminology, and interpersonal communications. And those 3 classes can be completed completely online. After completion of the phlebotomy program, which is the 1-semester program, our students are qualified to sit for a national certification exam through ASCP. And this just gives our students extra qualification to make them more desirable and more hireable by our local affiliates and hospitals. And again, this is a nationwide certification. And so this qualifies them for hireability across the nation. Professor Moody?
Okay, well, so that is our phlebotomy program. I've also been an instructor for that program. It's an excellent program. It really does prepare you to work within that field to a much greater degree than many of the other programs I've seen. I have seen that there are some short 1 or 2 week classes where they will provide you with an alternate version of a certification and show you pretty much how to hold a needle. And our graduates are prepared not only for that national gold standard certification, but when they get hired, they're capable of jumping right in and doing more than just drawing blood from the patients, for being a real part of the lab team. And we get a lot of positive feedback from employers after they've hired our graduates about how much more well-rounded and much more capable our graduates are. The next program that we'll talk about is our Medical Laboratory Technician program. That is also one of Professor Lester's programs. I will teach a couple of classes for those, but she is the head honcho of that one. So I'm going to let her talk about the MLT program.
All right, so the MLT program is Medical Laboratory Technician. It is an Associate of Applied Science program. It's a 21-month program. The MLT program, students are also qualified for a national certification test, the ASCP MLT exam, upon completion of the program. So what does an MLT do? So the MLT is responsible for performing a myriad of tests in the laboratory. They test for chemical imbalances, infections, they test patients' blood types, They prepare the patient for transfusion by testing the patient's blood type and then looking over the selection of donated blood units that they have in their stock. And then they select an appropriate donated blood unit and cross-match that with a patient and make sure that it is a compatible unit of blood. So they're integral in the transfusion of blood products. They test for and detect blood disorders, and they're responsible for genetic testing. So some of the specific classes that we have in our program, in the first semester, we start out with Intro to Clinical Laboratory Science, along with urinalysis and phlebotomy. So Intro just is a basic introduction to our core courses, and then also urinalysis and phlebotomy. So you do learn how to diagnose and find lots of interesting things in urine. We also learn phlebotomy in the MLT program. So it's not necessary that you complete the phlebotomy program before you complete the MLT program. A lot of our phlebotomy graduates do continue on through our MLT program, but it's not a requirement because we do cover that in the MLT program. We also start our students off with immunology in the first semester, and that's because immunology is so important in all of the other core areas. And we talk about immunology and hematology and blood bank and microbiology and chemistry. And so we start our students out with immunology so that they have a good foundation for understanding all of the immunologic reactions that happen in the body. Immunology would include some of our rapid tests, such as influenza, strep, mono, and allergy testing. We move on to hematology, blood bank or immunohematology, and microbiology in the next semester. So hematology would be learning about white blood cells, which help you fight infection, about red blood cells, which carry oxygen to parts of your body, and about platelets, which help you form clots. Immunohematology is blood bank, again, seeing what type of blood you have, making sure that that blood is compatible. Microbiology, we identify different bacteria, pathogens. We have to decide whether the bacteria that is growing in a particular specimen is normal flora, which means that it's supposed to be there, or if it's a pathogen, which means that it's causing disease. Not only do we report out what that pathogen is or that bacteria is, but we also report out which antibiotics the physicians should use to treat that organism. We also are familiar with parasites and can detect different parasites in specimens. At the end of the first year, the first fall and spring semester, then we start our clinical rotations. So when our students start clinical rotations, they have completed most of the core classes so that they're very well prepared for clinical rotations. And clinical rotations during the summer semester are 3 days a week. We have 3 different clinical courses, clinical 1, 2, and 3, that starts summer 1, and then fall 2 and spring 2. We have a total of 720 clinical hours throughout the MLT program. We are doing clinical rotations right now. We were, due to COVID, our clinical affiliates were not allowing students, but they are, most of them are back open to students right now. Working in the laboratory, we are exposed to potential pathogens every day. So COVID is another pathogen in the laboratory world. This is something that we prepare for. We wear PPE every day. The only thing that's different right now is we're wearing a mask to protect ourselves from our coworkers in the laboratory. But this is what we train for. This is our job. And the affiliates recognize that, and they have opened back up to us. So we are, some of them have, we are doing clinical rotations. The clinical rotations, what am I trying to say? The first year of courses really prepares our students for clinical rotations. The clinical rotations are 8 different rotations over 3 semesters. They're anywhere from 2 to 3 days a week, typically on Thursday and Friday. During the summer, it's Wednesday, Thursday, and Friday. And then in the second year, we moved into clinical chemistry, which is it's a big department, various chemical tests to monitor organ function, to detect chemical markers that may indicate a particular pathology. Then we move into molecular diagnostics, which everybody is probably very familiar with right now. This is where we do PCR testing, sequencing, and this is where most of the COVID testing is occurring right now. And then, as I mentioned, the 3 clinicals over 3 semesters. So one of the questions that we've been getting a lot right now is, how are we delivering these courses in the current situation? So all of our lectures are being delivered in an online format. And so we're meeting typically at our regular lecture time. Sometimes we have an abbreviated lecture, sometimes it's a recorded lecture, but we are delivering lecture in an online format. And then we are adapting as many labs as we can to an online format. There are some labs that we cannot adapt to an online format, like phlebotomy, for instance, with our intro students. But we can introduce our students in clinical chemistry, for instance, to the concepts, the basic concepts of clinical chemistry, also with molecular. We can introduce the basic concepts of the laboratory techniques, and then we can build upon those concepts in a virtual format for the remainder of the semester. So we are having limited laboratories in person, but the rest of the laboratories will be delivered in an online format. So what can you do with an MLT degree? You can work in a laboratory. There are various different laboratories that you can work in. You can work in a hospital laboratory. You can work in a particular department in a hospital laboratory. So smaller community hospitals will have what's known as a generalist, and a generalist will typically be expected to be proficient in several different areas. So typically that would be hematology, immunohematology, which is blood bank, and then general chemistry and some basic microbiology skills, such as setting up cultures and reading gram stains. In our larger hospitals, MLTs typically will focus in on one specific department. So if you really love microbiology, you may seek a job just working in microbiology. In that case, you probably would not do phlebotomy. You probably would not get a lot of experience if you chose that job in hematology, chemistry, or blood bank. There are some reference labs that you would be qualified to work in as well. So lots of different jobs out there. There is a huge job shortage for laboratory professionals. So this is a fantastic time to get into the profession. Even before COVID-19, there was a big job shortage, lots of open vacancies in this field. And now with the demands of COVID, there are even more vacancies right now. So we have hospitals that are hiring our students as collectors, as patient monitors. We've had many of our students hired very recently by local hospitals. Oftentimes, our students are hired even before they finish their clinical rotations by local hospitals, even before they graduate. After you complete the MLT program, you can work as an MLT. You can continue on. There are lots of different programs that are designed for the MLT to achieve their bachelor's degree and become an MLS, which is a medical laboratory scientist. You can get your master's degree in various different fields. And then there's even a DCLS, or a doctorate in clinical laboratory science, should you decide to continue your education to that point. And then, as I said earlier, there is a national certification exam that we prepare our students for, and that is the ASCP. And that is an exam that is a national certification that you take upon completion of the MLT program. Professor Moody?
Okay. So those are our medical laboratory technician and phlebotomy programs. And you can find out more information on how to apply and what the application process looks like through the CTC website. We do have a website for our phlebotomy program and for our medical laboratory technician program that includes our application packets, what the application criteria are, how to apply, what our deadlines are, and a little bit more information about our certification exam pass rates and our statistics for job placement. We are a nationally accredited program with the professional organization that accredits medical laboratory technician programs. And we have some very excellent outcomes as far as our pass rates and our job placement. We've also, there is a news article that was just recently put out about how there has been a shortage of these technicians for quite a while, and that the situation that's going on right now is highlighting that shortage, and we need more technicians. So the next program we'll talk about is one of mine. This is the Histology Technician, or the Histo Technician program, where the medical laboratory focuses on the function of the body, how it's performing its job, how it's balancing out all the chemicals and the components and the cells and the hemoglobin. Histology is focused on the structure. Are these cells doing their job? Do they look correct? Are they coordinating together correctly? Are the organs functioning correctly? We spend a lot of time looking at these cells and tissues under a microscope and performing testing on them for things like cancer or genetic disorders that have to do with how the structure is built. So one way that I kind of look at it is when you're fixing a car, the problem might be somewhere within the software, or it might be something having to do with some sort of contaminant in the oil or the fuel, or it might be some sort of actual misconnection or some sort of broken part. Where the medical lab side, what we call clinical pathology, is focused on what the car is doing and how it's functioning. Our focus is what is the actual structure and the assembly and the parts, and are they doing their job? And it's a very wide field that we're looking at, because the structure of the body does inform quite a bit how that function is being performed. We do a lot of work with biopsies. So anytime somebody has ever heard, oh, my biopsy results came back about this or that, we're the ones that are taking those samples of tissue and we're turning them into slides like the one that you see here, so that we can look at them and find out what's going on. Are these cells behaving correctly? Are they growing out of control and becoming a precancer or a cancer? Is there some sort of damage that's being done to them? And there are many different procedures that we can do with these tissues in order to really get in there and look at exactly what we want to see. So we do a lot of work with pathologists who are studying the slides and doing these the diagnosis, and with the healthcare providers themselves who are using these results to inform what their diagnosis is, what their choice is going to be for treatment, for tracking and monitoring how well those treatments are going, and for deciding on what the next step is. We also do a lot of research. Histology technicians are always in demand in research fields because we can use any of those different techniques to study what's going on with the cells when we are putting them in a lab environment. So many students, I have had a couple of students that have ended up working in research laboratories. I'm in contact with a couple of research laboratories that are always on the lookout for graduates. There's an Alzheimer Research Center in San Antonio that I let them know anytime I have a graduating class, they're always looking for somebody to help with doing brain research for Alzheimer. We also work quite a bit with the forensic field in forensic pathology, determining things like autopsies or cause of death or toxins or poisonings. I know that some people are very interested in working in one of those fields, and there's a lot of shows about that, and there's a lot of work that's done into it. And I've done forensic work myself as part of a histology lab, and it's always fascinating. It's really getting in there. It's solving the mystery. It's all the most interesting parts of all of those shows, whether it's that medical diagnosis show where they're trying to find out what that mystery disease is. It's the MLTs and the HTs and the pathology department that's really doing that investigation. The doctor just signs an order and waits for us to solve the mystery and send them the results. And when it's those forensic shows and they're going in there and they're doing those autopsies and trying to determine what's going on with that, we're doing that with the medical examiner. We're assisting that medical examiner. And so there is a very wide range of fields that are available to histology technicians. Everything from working in a hospital, working at a cancer center, working in research and trying to get more information and solve more mysteries about what's going on. Histology labs have been at the very front of the research side of the COVID-19 pandemic, where we're trying to determine exactly how this virus works and what doesn't work against it as a treatment by growing these cells and by investigating cases. And we also end up working quite a bit in many forensic fields as well. So our histology program is also a 2-year program. It's an associate's degree. We start our students out with an introduction to the entire field, in our introduction to histology, and we start working on our functional histology classes, where we investigate and learn how to read these slides, how to identify these different cells and tissues, and how to know what these normal tissues look like and how they're supposed to be arranged and structured, and what goes on when that structure breaks and the different diseases that can be associated with that. And those classes are usually taught in conjunction with a pathologist, with an actual person who has a MD, who has a doctorate degree in the study of pathology. And we spend a lot of time looking at these cells and learning how to read and interpret them. And that works very well for this first semester, being mostly online, because we can look at these images together. We can study these images together without necessarily having to be in the same room. So we can, for instance, and let me pull this up here. see if this is going to pull up correctly. And I can show you
Professor Moody, you need to
Yes.
make sure that you're sharing the program that has what you're trying to show.
right. And I need to stop sharing our the slideshow. So give me 1 second to get this. And I will pull this up. So what we can do is we can actually, using a real microscope and learning how to work it and how to function it, we can be looking at these cells together and discussing what's going on inside of the body as we study these. And you can see as we go over this that we can get some very high quality images. We can be studying all of these different stains and all of these different treatments. And that's a big part of what our first semester is going to be. In the second semester, we start working more with the actual specimens. And at that point, we do have a fully functional laboratory at the college where we can perform all of these techniques in person. We do have all the equipment that we need to do. And we spend the spring and the summer semester learning how to do these techniques in our student lab. And then for the last 2 semesters, we go over some of our more advanced techniques. We learn how to prepare samples and how to run an electron microscope. We learn how to do fluorescence and immunohistochemistry using antibodies to tag certain things on cells. And these advanced techniques are used a lot in research. And we also start the clinical rotations. At the moment, our clinical rotations are limited, as everybody's are, but we do have affiliation agreements with local hospitals to be doing those. And if there isn't a clinical rotation to be able to go to, we still have a fully functional lab with lots of specimens where we can spend all day long working on getting better at doing what it is that we do. And it's an incredibly interesting field to me. All of the different stains, all of the different processes, all the ways that we can highlight what's going on inside of the body just from a tiny little sample, a little needle core, or a little piece that a surgeon takes out in order to try to find out what's going on. There are even times where we can be going up to where the patient is, and right outside the surgical suite, the surgeon will take a small piece, a small biopsy, or do a resection to remove a tumor, say, and then hand it straight over to us. And while that patient is on the table, we can give that physician, that surgeon, the answers over whether or not they got all the tumor in to say, or this is what type of cancer it is that you're looking at while that patient is still there, so they don't have to come back and get further procedures. So we work very closely with our pathologists. We work very closely with our surgeons and our oncologists and our other physicians in giving them the answers as quickly as possible. So those are our programs. And we didn't want to give you a big list of volumes and volumes and volumes of text because, well, nobody wants to see that. But we did want to give you a quick overview. And then we wanted to be able to spend some time answering questions or giving you some further information on what it is that we do, or if you're interested in these sorts of fields, how you could get started working on that as a career. So this is the point where we're going to open up for some questions and hopefully get some of you out there just as excited and passionate about this field as we are.
Can you please elaborate a little bit on how the classes, since most of the classes are not going to be in present, how that's going to work for this semester especially?
Sure. For these classes, all of our lecture portions are going to be online. And what we're going to do for these is we're going to have the class at the normal time that the class would have been scheduled for online. So you can still show up, you can attend class, you can discuss, you can raise your hand, you can ask questions, and you can interact with us. We want to make sure that it's a fully interactive and that it's not just, here you go, here's some slides, here's some videos, go teach yourself. That's not the way that this works. And we will also record those sessions. So if you can't make it for some reason, if you have family members that you need to be taking care of, or if you have a full-time job and you're not able to make it for those times. So we do have a synchronous class that goes on, but it's not listed as a synchronous class. It's listed as our online blended learning, because you can attend in person or you can view the recordings. And for our lab portions, we have a good amount of simulated labs or distance labs, for instance, going through and looking at those cells under the microscope. And we do have the approval to do in-person labs for those times when there's no substitute for the hands-on. For our phlebotomy, there's no way to simulate or to virtually or over a webcam teach somebody how to do phlebotomy. And for our histology classes, there's no way to teach somebody how to embed tissue just right and then cut it so that we can put it on the slide. So we are able to do in-person classes. We're doing them as limited as we possibly can. And we are requiring masks. We're limiting the number of students that are there at any one point in time and holding multiple sessions if needed. We are decontaminating our labs before and after. As a matter of fact, we've always done that. That wasn't new. There was always a requirement that as soon as our students come in, they have to put on their PPE and decontaminate their labs before and after each lab. The only difference is now we'll be wearing masks and staying a little bit further apart than we normally would. And with that, for us, it's been, I'm not going to say it's been a smooth transition, but it's been definitely smoother than I would imagine a lot of other work-based programs have been, because we're able to have that mix of the knowledge that you need and still being able to work on the skills in a safe environment. And what we're finding is that it's actually becoming more available, more inclusive, and more accommodating for students to be able to do it this way. And some of the practices that we're doing in response to what's going on right now may end up becoming practices that we'll continue to do because it's better for the students. Professor Lester, do you have anything to add to that?
This is a fantastic field to be in. If you really love the idea of being in medicine, but you might not like so much the idea of direct patient contact, if you really love science, if you love mysteries, if you love puzzles, if you like solving puzzles, figuring things out, then this is definitely the field for you. It's a lot of fun. You're integral to the decisions, the treatments of patients. 70% of medical decisions are based on laboratory results. So while a lot of people don't know that we exist, we are very important in the treatment, the diagnosis of patients. I think people know a lot more about us now because you hear a lot more about us in the current situation. You hear about testing, you hear about reagents and about swabs and about false negatives and false positives. We have the benefit of really understanding what all of that means and understanding the significance of all of that. But it's nice that now people in the general public understand that we are here, that we are a part of the healthcare system, and that we have a vital role to play. But even when there's not a pandemic, we're still here and we have a vital role to play. And even during the pandemic, with all of this additional COVID testing, there are still people having heart attacks. There are still people with cancer. There are still people going in for their annual exams that need annual blood work. And so there's still a lot of work beyond COVID testing that is being done in the laboratories that we are keeping up with. So it's a very exciting field to be in. There are lots of jobs available. There are lots of different fields of study, even within the laboratory, that you can go into. If you are a very visual person and you like looking at things under a microscope, you like looking at different tissues, then histology may be for you. If you really like the idea of working with bacteria, then microbiology may be for you. If you really like working with instrumentation, and if you are a mechanic at heart, then chemistry may be for you, because a lot of time in chemistry, you're calibrating, you're mixing reagents, you're fixing and troubleshooting different analyzers. So there is a lot of variation within the field, and it's just a very rewarding profession to go into.
Now, is there a specific uniform that students would need to wear when they come to class?
Yes, so we do have a royal blue scrub set that's available in the bookstore. It does have on one sleeve, it has the CTC logo and the program of study. So the histology, the phlebotomy, and the MLT program all have royal blue scrubs. And then they are distinguished by the different program of study on the sleeve. And then they say student on them. We also have a lab coat requirement. So the lab coats are also available in the bookstore. It's a full length lab coat. The short lab coats are not permissible. And that's because we are working with real patient specimens and with lots of different chemicals in the laboratory. And ultimately, we want to be safe in the lab. So we do require a lab coat for all labs. We require closed-toed shoes, preferably a leather or nylon shoe with no vents or holes in it, so that they're impenetrable to patient specimens and to chemicals. And we also provide gloves for our students. We currently, in this situation, are requiring face masks. The face masks are available in the bookstore as well. So all of these can be purchased, with the exception of the shoes, can be purchased in the CTC bookstore.
And those will have to be purchased online right now as the bookstore remains closed. So.
Correct.
Right.
Yes.
We also do have an optional jacket. It's a black jacket embroidered with the CTC logo that we will allow in our classrooms as well. Most of our facilities will allow an undershirt under the scrubs, either gray, black, or white only. They will not allow other colors to be worn underneath the scrub tops.
We share where to find them. Okay. And there is a lot more information about our programs, about our requirements, about our applications And you can see this is the CTC website. You can look it up by Medical Laboratory Technician. There is a section for Phlebotomy Technician and one for the Histology. It includes the degree plan, descriptions of each of our courses, application packets that include all the information that you're going to need to submit for your application. When you're applying for any of these programs, we do have some additional requirements on top of the CTC requirements that we need to meet in order to allow you to go to your clinical rotations with the local hospitals. You have to meet the same standards that their employees do. So they check to ensure that you've had all the appropriate immunizations, that you've been screened for tuberculosis, that you've gone through a background check and drug screen so you meet the Texas state standards for healthcare workers. And we help you take care of all of that when that time for that application or when the time for the clinicals begin. We have services that are available that will take care of all of those for you and make sure that you are going to meet those standards that you need.
So one thing that I'd like to mention is we also do have a requirement because of our affiliate sites, so our clinical rotation sites, of a background check and a drug screen. And this is not completed when you enter the program, but this is completed 45 days or within 45 days of when you start clinical rotations. So this will be different for each program. For phlebotomy, since it's just a 1 semester program, it will be completed very soon after you start the program. For histology, it will be completed right before the second fall semester. And for MLT, it will be completed right before you start the first summer semester. So this is done through a program that we use called PreCheck. And you will create an account through PreCheck. And you will submit your, they will give you instructions on where to submit your drug screen. It'll be a urine drug screen, and then they will perform the background check. But everybody is required to complete these requirements before they are allowed to continue on through clinical rotations.
And the cost of those is included in the tuition for the courses. Okay, do we have any other questions?
We do not have any other questions at this time. You guys have been great. Thank you very much for the information. I hope that this has been something that if somebody was considering taking some classes and maybe in the medical field and they weren't sure what other options other than maybe doctor or nurse, this might be a really good option for them to look into. I really appreciate the time and the effort that you guys have put in so that we can have all this information put out in a nice, succinct way. And to everybody out there, thank you for participating. If you have questions, please make sure to contact the department, and you're welcome to contact both Professor Moody and Professor Lester. And hopefully you will actually take the time and ask a lot of questions when you have that opportunity. This will hopefully help guide you in the process for the future. Thank you to everybody who participated. Thank you, Professor Lester and Professor Moody. I really appreciate your help. And we'll be talking to you guys next week. Thank you very much.
Thank you.
Thank you.